welcome back. Football season has begun, and while this means friendly competition and a great weekend of activities for many, there is typically one common concern that does arise among families who have students playing the game. It's safety. So joining us this morning to discuss concussions in sports is Trinity Mother Francis trauma surgeon Melissa Cloonan. Good morning.
Good morning.
So is this something you see pretty commonly?
It is, and a lot of times it picks up during certain times of the season, particularly football season. Also see it in hockey season as well.
Yeah. Oh, I bet. That doesn't surprise me.
Yes.
Yeah, I know there was a case, wasn't it, in Louisiana recently, where a football player had died from a hit. So obviously,
yeah,
if it's just right. I guess the helmets do their best to protect, but that doesn't always do that. What do you do when somebody comes in, and then what do you do to check for one, and then how are they treated, the concussions?
So a lot of times when people come in with a concussion, a lot of people think that they had lost of consciousness, which isn't always the case. So they may have lost consciousness or not, but a lot of times they come in confused, they're hard to arouse, they may have nausea or vomiting, severe headaches, sensitivity to light and sound. And so depending on the severity of their symptoms and any other injuries, then that's when we would investigate to make sure they didn't have anything other serious injuries like a head bleed, which could also be associated with a concussion.
Oh yeah, I imagine that's not good either.
That's not good, no.
So essentially, what is a concussion? What happens? What does that even mean?
So it's when you have an injury to the brain and you have neurological or brain impairment. And so you end up with these symptoms like I was just talking about, where you're just kind of foggy, you're really slow to move around or arouse. And it can be mild symptoms, or it can range to really significant disability and permanent brain damage.
Wow.
Yeah.
How long does, well, it probably depends on the severity, and maybe answering my own question of the concussion, but how long is one out? How is it determined that a player is ready to go back to the end of the game or back into a football game in future weeks?
Right.
Yeah, so if one is suffered on the field, then they're done for the game, for sure, just to make sure everything is okay. But a lot of times symptoms last from weeks to months, and you really can't go back to playing sports until all of the symptoms have resolved. Because if you get another concussion when you have those symptoms, then you could have more brain damage that could be permanent.
Wow. So is there any sort of treatment that you can do when dealing with a concussion, or do you just have to wait it out?
A little bit of both. So you really do have to wait it out, but the big thing is just total brain rest. You can't have any other injuries to the brain, but you also have to limit the amount of stimulus that the brain gets. So limit TV, video games. For kids, you have to limit their schoolwork, things like that.
Oh man.
Wow, so that's crazy. So they get better and then eventually go back into the game. How do we learn more about this? There's some links through Mother Francis?
Yes, we actually have a couple of links and a couple of videos on our website to check that out. It's on our sports medicine website. But there's also some information out there also online nationally as well.
Right, and then any advice you want to give students who may be playing football or any other sport right now?
Yes, so wear your helmet, make sure it's working well, and if you do have these symptoms of a concussion, keep yourself out of the game. I know it's really hard, everybody wants to get back in the game, but staying out is really the best thing.
Yeah, I would say so.
Yeah.
Well, thank you so much for joining us.
You're welcome. Thank you.
Coming up next here on Fox 51 Today, we're going to take a quick look at today's forecast.